Today, my name is Chase Martin, and today we are going to do PEG Med administration. So, upon approaching your patient, you want to verify that your patient is who they are through the use of your two modifiers. So you're going to ask them their name and date of birth, and compare that to their medical record to ensure that you have the correct patient in front of you. Upon that, or while doing that, you can perform hand hygiene to make sure that your hands are clean, so that you don't cross-contaminate your patient or allow bacteria to enter any part of your patient's sterile environment. So for PEG meds, first thing you have to look at is placement. So you're going to verify that your PEG tube is in the correct place. So you can do this in two ways. You can inject air and listen for bubbles inside the stomach to ensure that you're there, or you can also extract some gastrointestinal fluids and test for pH. Today we're going to do the air method. So for this, we're going to do a plunger. We're going to withdraw 5 milliliters of air. We're going to connect it into our patient's port, and we will verify by inserting it and listening with our stethoscope for sounds of bubbling. With this being verified, we're able to move on with med administration. So we will remove our syringe here and cap it so that none of our patient's juices backflow out, upon which we will get our med solution. We will check against our MAR before administration, as well as doctor's orders, to verify this med goes to the correct patient and what amount. When delivering liquid meds, you want to verify the amount that you need to pour and be a level height. For this case, we're going to pour 10 milliliters of the scheduled med, upon which you verify that you have the correct amount, cap your med, and return it. So for the process of administration, you're going to pull, because all PEG meds are done through a gravity system, you remove the back end of the plunger so that you just have this part. You'll be putting this attached back in, upon which you will clamp down on your on the tubing so that you are able to make sure that your med stays in the correct area. But before we do this, we're going to flush the tubing to make sure that there are no particulates that will mess up our count. So we will be doing anywhere between 30 and 60 milliliters is the typical amount used for flushing. So we're going to do 30 in this case. So you're going to flush and infuse the water through. Before it ends, you will clamp back so that you have an area of recourse so the air doesn't go in or out. Then you apply your med. You will do the same thing. You will release your med down until it is just about through, upon which you will clamp so that you don't have any water going back through. Upon which you will then add an additional 30 to 60 milliliters to flush your med through the system so that all the med is through the tubing and into your patient so they get the correct dosage. So you let this completely drain through by gravity, upon which you are able to clamp, remove your tube, or remove your syringe, cap it, and ensure that your patient has a sterile, clean environment before moving on.